All right, welcome everyone. We're going to talk about this paper called Clinical Outcomes Among Patients Infected with Omicron in Southern California. This is a study out of UC Berkeley and Kaiser Permanente, Southern California. And let's go over the abstract really quickly for people who just want to get the results, and then we'll dive deeper into the actual methods and specifics of the paper. So in this paper, what they did is they analyzed all the patients in the Kaiser Permanente system in Southern California from November 30th to January 1st. That's essentially the entire month of December because that's when Omicron started picking up in Southern California. And what they did is they used PCR testing. And when PCR testing is done, they test for the spike protein and the nucleocapsid protein and the open reading frame protein. So it's test for three things. The nucleocapsid and the open reading frame, one protein is the same in Omicron essentially, and it picks it up. But the spike protein is mutated so much that the PCR will not pick it up. So basically, they called it S gene target failure, and that is a proxy for Omicron. So if the PCR fails to pick up the spike protein, they assume that it's Omicron. So our analysis included 52,000 cases of S gene target failure or Omicron. Most of these will represent Omicron. It's possible that there's a few variants that are not Omicron that also are not picked up in spike gene, but like probably 99% of these will be Omicron. And then about 17,000 cases of non-SG target failure, which is almost predominantly going to be Delta. Hospital admissions were 235 with Omicron and 222, which represents 0.5% and 1.3% of cases. So basically, if you got Omicron in their study population, your chance of getting hospitalized was 0.5%. If you got Delta, your chance of getting hospitalized was 1.3%. Then they looked at not only hospital admission, but also ICU admission, mechanical ventilation, and death. And what they found out was that symptomatic hospital admission associated with Omicron was 0.48 and 0.47. So any hospital admission for any reason, and the one we care about is symptomatic hospital admission. That means you were admitted to the hospital because of COVID, not because they just happened to, you were admitted for something else like appendicitis or something, and they happened to find out that you had COVID. So this is the symptomatic one is the one we care about. It's 0.47 compared to Delta, which means that you have 47% of the admissions compared to Delta. So about 63% less likely. Rates of ICU admission were 0.26. So the chance that you would get admitted to the ICU if you got Omicron compared to Delta was 26%. So 74% less likely. And then 0.09, which means you're 91% less likely to die from Omicron, which basically means that the fatality rate is tenfold less in their population. Mechanical ventilation, they couldn't really tell because there's 0 cases of Omicron that ended up on mechanical ventilation. And then they looked at duration of hospital stay, and it was 3.4 days shorter, which is a 70% reduction. So significant decrease in significant decreases in hospitalization, ICU admission, and death, especially death, tenfold less, and way shorter length of stay. Okay. So let's dive into it. For people who want to kind of get more details about this. So Kaiser Permanente is an integrated comprehensive healthcare organization serving 4.7 million people. So this is a huge healthcare system in Southern California, and they cover about 20% of the population of Southern California, or almost 5 million people. So it's a huge data set. And that's why I think UC Berkeley went to Kaiser and asked them to get the data from them, because they have an integrated electronic health record that they can query as a database. So it's a great data set. All right, so what they did is, again, like we talked about, they used a PCR test, and this amino acid deletion, the spike protein of Omicron, causes failure of the PCR probes that target the spike protein, whereas the open reading frame 1 and the nucleocapsid proteins retain sensitivity. Okay, so we talked about that. So basically, they're using spike protein target capture on the PCR test as a proxy for Omicron. And then they did a bunch of, they looked for a lot of different comorbidities, and they tried to do some statistical analysis to find out what the differences, to kind of like parse out the differences. Okay, so let's look at the tables. All right, so this is table 1. Association of SGTF, so this is Omicron, association of Omicron with adverse clinical outcomes. So, any hospital admission, well, we don't care about that. Let's go to symptomatic hospital admission. They're very similar, so it doesn't really matter. But if you look at the unadjusted hazard ratio in all cases, and actually, you know what, we should probably just look at cases tested in the outpatient setting, because this is more relevant, because this is what we care about. If you got tested in the outpatient setting, see, these people were tested after they already got admitted to the hospital, but these are people that got tested in the outpatient setting. So you want to look at this, and you see it's 0.31 for an unadjusted. So you're 69% less likely to be admitted to the hospital. And then if they adjust for other comorbidities, it's 0.47. This is the number that they give you in the abstract. So 53% less likely. And you see the 95% confidence interval right here. It goes from 0.24 to 0.41 and 0.35 to 0.63. So these numbers represent kind of percentages, the ranges where it could be based on their data set. So it doesn't vary too widely, so it's pretty tight. ICU admission, they didn't have enough ICU admissions to run adjusted analysis, so you get unadjusted, and what you get is 0.26, and this is the number they give you in the abstract. So 26% of the people that got Omicron were admitted to the hospital relative to Delta. So basically 74% less likely. And then death is 91% less likely, which means that chance of death is tenfold less, more than tenfold less. This is just a bunch of the things that they looked at, age, gender, race and ethnicity, medium income in their neighborhood, whether they smoke, their weight status, whether they were seen in the hospital a lot, Charlson Comorbidity Index. This is just an index that tells you how kind of sick you are, how healthy you are, or how not healthy you are. And they also, this is, I think, a really important thing, is they looked at the vaccination status and see how that affected things. So if you see here, this is a graph, and let's zoom in on this a little bit. Okay. You can see here, the gray represents Delta and the pink represents Omicron. And you can see that Omicron starts taking off in their data set around December 13th. And then it rapidly becomes the dominant one. Delta stays relatively the same. So it's not like Delta's disappearing. It's just that there's a lot more Omicron on top of it. And most of this increase is Omicron. And then what you notice in ages is that the age group that's getting hit the hardest is the prime working age group, late 20s to early 40s age group. And then when are they getting admitted to the hospital? It starts earlier because I guess some of these early ones still got captured in there. And the scale is much less, so you see even small numbers. Like, see, this is in the thousands. This is like 10, 20, 30. So even 1 or 2 patients are going to show up. 1 or 2 patients are not going to show up on this graph. And then ages of hospitalized cases, you see that the majority of the cases here are in the late 20s, early 40s. And then you see that the hospitalization cases look similar to the cases, but it shifted to the higher age groups. So you see, like, there's very few in the over 70 group that are getting infected, but they represent a larger proportion of those that are hospitalized, which basically shows if you're older, you're more likely to get hospitalized. And then you see all these younger people. There's quite a few of them, but almost none of them are being hospitalized. So younger people are going to do better, which we kind of knew about. And then this is green is Omicron, and then purple lavender is Delta. And you see that the rate of hospitalization increases faster. ICU admission the same. Mechanical ventilation you can't really say because no one got ventilated on Omicron. And then mortality, you see that. So it's all worse for Delta. And then this is their hospitalization, which shows that this is how long the people that have Omicron get admitted to the hospital. Most of them are out of the hospital in 5 days, whereas Omicron has, there's people staying in the hospital for, 16, 18, 20 days. Okay. But I think that so they actually took a random sample of them and they found out which one of them were Delta and Omicron. And so it shows that the non-SGTF is 99.7% Delta, and the SG target failure is 100% Omicron in the sample size that they took. So they only tested 382 of them. Of course, it doesn't, since their whole data set was like in the 80,000s, it doesn't mean that one or two of them were not Omicron. But basically, this goes to show that most of the non-SGTF are Delta, and most of the SGTF are Omicron. Sorry. Okay, so this I think is where it gets interesting. Okay, so this is a supplemental table. They don't really talk about this in the abstract, but this is very interesting to me and probably pretty interesting to you. So this says, out of these factors, how do they affect the differences between Delta and Omicron? Like, does Omicron change how it affects people with age? And it looks like probably not. Probably not. It's 1.03. Oh, okay. So this is not between the two, but within each group. So in Delta and in Omicron, so this is Delta, this is Omicron. Looks like increasing age affects Delta a little bit more, like 2% more. So every year increase in age increases your risk of hospitalization by about 2% more with Delta. So it's 5% absolutely and 3% absolutely, so 2% more here. And then in gender, it looks like for whatever reason, and we don't know why, it's worse to be a male for Delta. See, higher numbers is worse. And it's better to be male a little bit for Omicron. But if you look at the 95% confidence interval, it crosses over 1. So in this one, you can't be 100% sure. In this one, it never both confidence intervals are above 1, so it's definitely worse to be male if you're Delta. Then in terms of gender, race and ethnicity, so compared to white people, if you're black and you get Delta, you're a little bit worse off. And Omicron, a little bit worse off. If you're Hispanic, twice as bad if you have Delta. And actually for Omicron, about the same. If you're Asian, it's kind of bad news for me, you're more than twice as bad off for Delta and about twice as bad off for Omicron. So being Asian, for whatever reason, makes you a little bit more likely to be, actually quite a bit more likely, double, to be hospitalized. And then if your income increases, you're less likely to be admitted to the hospital, slightly. with Omicron, about the same for Delta. This doesn't make any sense to me, and I don't know why this is. If you're a smoker, you're less likely to be admitted with Delta and more likely to be admitted for Omicron. I don't know why that would be, but that is a fairly clear relationship in their study. For body mass index, for every unit of BMI, you're 5% more likely to be admitted. So like, if your like normal BMI is about 20, if your BMI is 40, then you're like 5 times 20. That's a lot. That's a lot. It's 100 times, 100-fold increase. 100% increase in admission. Then let's look at vaccination, because this is what we care about. So looking at Delta, this is the Johnson & Johnson vaccine, and this is 1, 2, or 3 doses of the mRNA vaccine. So BioNTech, Pfizer, or Moderna. All right, so let's look at this. If you look at the Johnson & Johnson, you're 0.22, so almost 80% less likely to be admitted with Delta if you have vaccinated. Now, this one looks bad. Like, why with a booster dose would you be worse? But this number, the number of patients with this were so low. So let's go back up there and look at it. Okay, so let's look at this. If you look at the number of people with a booster dose, there's only 85 of them in their study group. See, the vast majority of people, if they were vaccinated, they got the mRNA vaccine and they got 2 doses. And then about 50% of their population were not vaccinated. So, and that's 50% of the cases that were admitted to the hospital were not vaccinated. And what you'll notice is in Omicron, there's relatively more people being admitted to the hospital that are vaccinated compared to unvaccinated. Now, what you have to think about is, I think that the vaccination rate in Southern California is probably 70 to 80%. So if the vaccine offered no protection, you would expect the unvaccinated people to be about 20 to 30%, but instead they're 50%. See, this is 20 to 30%, which basically is showing you that the vaccines are not very effective for Omicron here. Okay, but anyways, the Johnson & Johnson number with a booster dose is so low, the numbers, that it's not very reliable data down here. So that's why this looks like a booster dose is worse than 1 dose, which probably is an artifact of their sampling. And then 1 dose is 75% less likely, and then 2 doses is 85% less likely, and 3 doses is 85% less likely. This essentially shows by their data set that a 3rd dose isn't very effective. However, the 3-dose population is also quite small, so this data is not super reliable. And then what this shows is that for Omicron, the vaccines are a little bit less effective. They're probably about half as effective as they are for Delta. See, do you see that this number is quite small? This number is about double this number. So it's just not quite as good. Okay, so I think that is mainly what we want to get out of this. Yeah. The take-home message is that vaccines do help. They do help with Omicron. They reduce symptomatic hospitalization by about 60%, 60 to 70%. It's not as good as before when it was like 80 to 90%. But it is somewhat helpful, but it's not as good as Delta. And that overall Omicron, even after adjusting for comorbidities, is probably about 1/3 as dangerous in terms of ICU admission, and 10 times less likely to cause death. This is a fairly large study where, let's see, what was their numbers? Yeah, so they have numbers of 90,000. So they were looking at 90,000 positive tests. So it's a huge data set. So it's pretty reliable data. And what we find out is you're more than half less likely to be admitted to the hospital, and then you're two-thirds less likely to be admitted to the ICU, and 10 times less likely to die from Omicron, even adjusting for comorbidities. And then vaccines are not as helpful as they are for Delta, seems to be about half as effective. But overall, in absolute numbers, it's about 60 to 70% effective in keeping you out of the hospital. They only had a single death of Omicron amongst all their admitted patients. So if you look at this, so they had 266,000 Delta positive tests and 14 deaths among those. And then they had 290,000 Omicron tests and exactly one death out of 290,000 positive tests, positive cases. So the death rate is extremely low. All right, so I will link this paper below, and feel free to peruse it yourself, and thanks for watching.